A pleasant day to everyone watching. I'm Jarek Aloro together with my classmates Kent Abanilla, Ana Adarle, Ira Bedrio, Miki Cabanero, and Sean Cepeda presenting our research proposal, The Nursing Student's Perspective Towards the Use of Online Distance Learning in RLE.
Purpose of the study. Nursing is a program that focuses on the application and enhancement of skills both in clinical settings and related learning experience of RLE. The barriers that inhibits the progress of learning clinical skills may change the perception of nursing students towards ODL. And so this study seeks to describe the perspective of students towards the use of ODL in RLE. Statement of the problem. Specifically, the study aims to determine 1. Nursing students' perception towards the use of online distance learning in RLE, and 2. Resources available to the nursing students, and 3. Factors to the overall online distance learning experience.
For the methodology, the researchers use quantitative, specifically descriptive research, which describes the characteristics, frequencies, and trends of the chosen research problem. The study is an adaptive survey questionnaire from the study of Gormley, with a target population of 123 with a 5% margin of error from the Level 3 nursing students of the University of St. LaSalle. The researchers used Goodenskate's validation rating scale to ensure the validity of the questionnaire used in the study, with an average mean of 3.4 to 3.9, which is interpreted as generally very good. And in determining for the reliability of the instrument used, the researchers used Cronbach's alpha test with an average score of 0.8, which is interpreted as acceptable and good.
Moving on to the results and discussion. For the first block, the Level 3 nursing students' perception towards the use of online distance learning in RLE in terms of attitudes. 35% of the participants agree that online demonstration videos is useful in learning clinical skills. The association is likewise esteemed, as video conferences can be recorded so the students could learn and reassess the different procedures again at whatever point required, as this method, as shown in the findings, for having the highest categorical value, is perceived by the participants to be useful in learning clinical skills. Study habits. 41.5% of the participants agree that they find online demonstration videos useful for RLE. However, the result shows that the majority of nursing students in this study did not feel confident in their competence to clinically manage patients. Subsequently, this also resulted in some students not studying before RLE sessions as they develop passivity in the learning process. Perception of the digital learning environment. 40.7% participants both strongly agree that demonstration videos are the most useful medium for learning clinical skills. The study shows that although there are mediums that students can use in learning, most students still prefer face-to-face classes to improve their clinical and technical skills. There is a significant gap between online learning and face-to-face classes, since online learning has more barriers affecting the effectiveness of learning compared to classroom teaching.
For the second block, for the resources available to the Level 3 nursing students for online distance learning in RLE in terms of technological gadget, a majority or precisely 88.6%, 109 of participants, prefer to use laptops in online distance learning and RLE. This is followed by cellular phones, tablets, and personal desktop computers, as they find the former convenient in RLE. For the average time spent, as presented, 23.6% or 29 participants spend at least 5 hours in online distance learning in RLE, which is the highest, followed by 8, 4, 10, 7, 9, 6, 3, and 1 and 2 hours respectively for the average time spent on distance learning. Most of the time spent is attributed to watching demonstration videos and relearning the skills needed for RLE. Data provider. 92.7% or 114 of participants have access to wireless fidelity or Wi-Fi routers for online distance learning, followed by the use of mobile data, USB modems, and pocket Wi-Fis. This is because students find Wi-Fi consistent in terms of use.
For the third block, factors contributing to the overall online distance learning experience of students in terms of first, data speed. 36.6% or majority of the participants have an internet speed of 11 to 20 Mbps. This suggests that students or participants have the appropriate data speed in joining synchronous activities for RLE. Next, for audio-video clarity, 48.8% of participants agree that they generally have good audio and video clarity. Third, technological fluency. The highest mean categorical value is 4.3, which suggests that students or participants are most confident in browsing the internet. However, our other variables also have a mean categorical value of 4, which means that students, in terms of technological fluency, are confident and fluent. Next, in terms of online interference, 32.2% of participants or majority experience online interference of at least one time per session. This is followed by 2 times per session and more than 3 times per session. This means that even though your audio video clarity is good and participants have fast internet speed, this means that it is not consistent all of the time. Moving on to the environmental interference, 95.1% of the participants experience power outage during online distance learning. This means that this type of interference is the most common among the participants. This is followed by disruptive background noise, household chores, and unconducive learning environment.
As for the conclusion, based on the results, student nurses feel neutral and they disagree on the overall usefulness of online demonstration videos in learning clinical skills for related learning experience. The shift from traditional forms of learning clinical skills to online distance learning seems a difficult adjustment for most of the nursing students. In conclusion, student nurses' perception towards the use of online distance learning is satisfactory, having a stable internet connection, utilizing online demonstration videos, and being technologically skilled students. However, hindrances are included such as online and environmental interferences. This study posits that students view online distance learning negatively when it comes to learning new clinical skills, as it does not provide genuine nurse-patient interactions and opportunities for practical application of the aforementioned skills. Therefore, further studies relating to the improvement of teaching clinical skills through online learning are recommended. The study is recommended for the benefit of University of St. LaSalle, College of Nursing, clinical instructors, parents, nursing students, and as well as future researchers.